Mic is open.
Good afternoon, everyone. My name is Chip Partner. I'm the Assistant VP for Communications at the University of Rochester Medical Center. I want to thank our friends in the media for joining us today as we welcome 15 members of the Strong Emergency Medicine team from the front lines of the COVID-19 pandemic in New York City. Specifically, they supported medical staff at Northwell Health's North Shore University Hospital and Long Island Jewish Medical Center for nearly a week. I'm going to pause here because I know we were having some trouble with video. Corey, if you'll unmute and just ask, is any station having difficulty capturing video right now or audio?
I've unmuted everyone.
I had difficult getting video, but I have it now. It's
Okay.
Mary McCombs from Spectrum. Thank you.
Looks good. Looks good here. Channel 13.
Is that Doug?
Fine.
Yeah, I'm good.
Yes, it's Doug. Yep.
Okay.
Yes, it's working. Sandra Knispel, it's working.
All right. Thanks, everybody. We're learning as we go along here. So this trip was initiated in part because of Governor Cuomo's request for clinicians to help downstate hospitals, in part also because our clinicians, and you'll hear from 3 today, were eager to support colleagues facing enormous challenges, and in part to gain insights for our medical center and our colleagues at Rochester Regional Health into what hospitals here could potentially face if there's a surge in COVID patients in the Rochester area. So we've got 3 terrific clinicians here to answer questions about their visit to New York City. Dr. Ekta Andrea Maglani is the medical director for emergency medicine at Strong. Wendy Allen Thompson is director of nursing for emergency medicine at Strong. And Jesse Schuff is a physician assistant in emergency medicine at Strong. So before we open it up for questions, I'll ask if Dr. Maglani wants to say just a minute or 2 about kind of who went on the trip and we saw.
Yeah. So first of all, thank you guys, and thank you, Chip. So there was about 15 of us. It was a compilation of nurses, docs, and APP advanced practice practitioners that went down. 14 of us that went down, and we served at 2 different hospitals while we were down there. There was a huge outreach. There was a huge outcry from our entire group in the emergency department of people that really wanted to go down, that were eager to go down to help support, and also gain some insights for our own community. And I think one of our biggest take homes was we were thrilled to be able to go and pitch in, roll up our sleeves, and we couldn't be more grateful for Northwell's welcoming us with open arms and just being so hospitable for us while we were down there and allowing us to jump right in. And I think one of the biggest take home messages that we had was we are right on track in terms of our preparing for our own community. URMC has done just a phenomenal job of really learning from all the places that were hit very hard, very quickly, and taking that knowledge into account and planning ahead, since we potentially have that little bit of lead time. And we'll be able to better serve our community if we get that type of a surge. The other piece that was really helpful for our group to be able to actually be in the milieu and understand what type of medicine was being practiced and be shoulder to shoulder with people that have been through it. So we are very grateful both for URMC and for Northwell, and we are also grateful that we are back and all healthy.
Thank you so much, Dr. Maglani. We're going to open it up for questions, starting with Mary McCombs at Spectrum. This is in the order that I think we saw people sign up beforehand. Before we do that, I want to make sure everyone knows we sent some still images that folks who went to New York City took on the trip, so you should have those. If not, you can use the chat function or go to Karen Christensen on the URMC communications team. We'll make sure that you have those images. And with that, I will ask Mary McCombs if you'd like to ask a question and a follow-up of our group.
Okay, great. Thank you so much for putting this together, and we're very happy that you arrived home safely and can share your experiences. I guess my question would be, for a lot of us that aren't downstate, where we have seen cases explode, the images on TV for people at home, it's so hard to really grasp what's really happening. In your experience at these 2 facilities, what was your reaction coming from, our hospital to a hospital like to hospitals like that, where you saw such, an influx of people? Could you just describe a little bit about that experience?
I would say that it was an enlightening experience. There was a beautiful show of teamwork throughout the facilities that we went to. It was amazing how everyone rose up to meet the demands the increased demands and the needs to care for their patients. There was some surprising, things that we saw there, but we really were just overcome by the resiliency, the strength, and the welcoming, and the support that they all had for one another and for us. We went in there to help them.
Anyone else? Jesse or?
No, that sounds about right to me. They were very busy. I mean, all the spaces that they had available to see patients were full much of the time, and the acuity level of patients, meaning the degree of their illness, was very high.
Yeah.
And do you have a follow-up, Mary?
In your opinion, do you feel that the healthcare workers you encountered and worked with had proper PPE and seemed to be, not stressing on that level?
Absolutely. I think that Northwell has done a phenomenal job of protecting their staff and making sure that they have the PPE stock that they need. And they've also done a phenomenal job of developing processes to make sure that when appropriate, that the life of that PPE could be prolonged for as much as possible as was safe. And I think what I was the most impressed by was, I think there's a lot of conversations about PPE that are happening ahead of time. And once people were in the thick of it, they recognized that we are protected and they were able to not have to worry about it, roll up their sleeves and get to work. There are certainly conservation efforts that are happening, but I think it's all been appropriate and their staff is well protected. And we were very well protected as well.
And I would just say at no time was anyone ever without PPE, and nor were they ever denied any PPE at all. So
Agreed.
that made me feel better to know that.
Agreed.
Thank you.
Okay, thank you so much.
And next up is Kayla Green from WROC Channel 8. And after that, it'll be Sean Lehman at the Democrat and Chronicle. Kayla?
Hi, thank you guys for taking the time today. So my question is, for people here who might not have kind of a grasp of how bad it is downstate, I mean, what would you say to people who may not still be social distancing here, who may think it's just not that bad, it could never get to that point, based on what you saw there?
I think I cannot stress enough that I understand that this situation has affected people in very different ways. Some people are very close to the medical community and some people aren't. But I cannot stress enough how important that this is for every member of our society and every member for our community to be looking out for each other and maintaining those social distancing practices. You may not know a loved one that's older or at risk or immunocompromised, but one of your friends does. And that's the people that we have to be able to do this for. And I also very much understand that we're living in a world that is atypical. The weather's starting to get nicer. It's really hard, but this is a marathon. This is not a sprint. And everything that we can do, and we're reaping the benefits in the Rochester community from everyone practicing social distancing. And it would behoove us to maintain that for that flattening the curve for as long as possible.
And Kayla, did you have a follow-up?
Yeah, I would also ask, when you were down there, did you notice anyone in the New York City area not really following social distancing? Or do you think because of how bad it's gotten down there, it's made them realize how important it is? What, compared to here, what did you see there with that?
Jesse?
Yeah, my impression was that people are really taking it seriously. I think it's hit that community hard. It seemed like everyone there, particularly in the hospitals, either they had COVID or knew somebody with COVID, a family member, a close friend. Everybody had someone that was affected in this community. This hospital that we worked at was really, over the past few weeks, they've really been one of the hospitals at the epicenter of all this. So it seemed like the community as a whole was really taking it seriously, and there was a lot of support in the community for us as healthcare workers.
I think we're lucky in this area in that we have the benefit of space, which is not always the case in sort of central New York City also. And I think what impressed me the most is the people who don't necessarily have the luxury of space are still trying very hard to maintain their distances as best as they can.
Thank you.
Thank you.
Next, Sean Lehman from the Democrat and Chronicle, and after that, Doug Emlich from 13 WHAM TV. Sean, do you have a question for our panel?
Yes, I do. Emergency departments are often very busy. I'm wondering if you had a sense for, given the influx of COVID patients, whether patients with other kinds of illnesses or injuries were being impacted by that? And is there a lesson from that that you can bring back to Rochester?
I would have to say that most of the patients that we saw that were there were very, all of them were COVID positive. There were very few people that weren't COVID positive. And I would think that, you know, you may have some aftermath because there's a lot of people that are probably staying home that need care, but they're staying home right now because of the COVID and they don't want to get it. So I would say that's what we saw, almost all COVID patients.
Yeah, and I think for that second part of the question of what can we learn here, I'll go back to what I said originally, where I'm just so impressed with URMC's planning, because what we really found is that you're right, the emergency departments in the hospitals can turn into sort of a hotbed for COVID. And what that means is that there's a reliance on outpatient measures, and there's a reliance on all the other measures that aren't necessarily central to the emergency department or central to inpatient care that are really important to be robust and functioning well. And URMC has done a phenomenal job to make sure that those outpatient resources were intact, that they're setting up the telemedicine telehealth whenever appropriate also, and making sure our community is being looked after even outside of the hospital. Because what ends up happening is there's a lot of fear for someone who might be having a critical illness about going to the hospital. But at the end of the day, all of those outpatient measures need to be in place, and all of those planning measures need to be in place, because strokes are going to still happen, heart attacks are still going to happen, traumas are still going to happen, and we need to make sure our hospital is still functional to take care of all those different components.
Okay, thank you. I'm good, thank you.
Okay, one question I'll ask, because I'm not familiar with the Northwell system. Were these two hospitals that are specifically designated for COVID care of Northwell patients, the way that Strong is the center for critically ill patients in the UR medicine system?
They are not COVID centers. I think what is very different, we have to make sure that we aren't New York. We have to make sure we understand we aren't New York City. New York City has COVID is endemic on a level that isn't the case here. And we don't know that it'll get to that point here. And I think a lot of our distancing measures are part of the reason why we might be able to save that off. So they don't necessarily have COVID centers, but what it comes down to is, even if you're coming in for something other than being COVID related, you likely have COVID also. So there's really no such thing as a patient that doesn't have COVID at this point.
Thank you. So Sean, if you're set, we'll turn to Doug Embledge from 13 WHAM TV, and after that, Jennifer Lukey from WHEC Channel 10. Doug?
Thanks, everybody. Appreciate the time and your service. As frontline healthcare workers, I'm sure go in with a game face and try to keep your emotions in check. Was there anything on this trip and this experience that got to you a little bit? Anything that surprised you in terms of the challenge of seeing the scope of the challenge?
I could just say it was very heartwarming. Having the opportunity was a real blessing. We were very supported by our hospital to go down there, and being able to help my fellow nurses and providers, and the difference that we made was incredible. And being able to help them was an experience that I'll never forget. So
I will say this, right now, coming from Strong, where our volumes are currently down, we haven't had the surge volumes that they've had. Walking through their ER initially, it was initially very intimidating. They're full. All the patients seem very ill. But what's amazing is, with everybody kind of coming together and working as a team, how fast that normalizes, and it just becomes a matter of getting to work and taking care of the patients. So.
I do think there's an important lesson for us to bring back for all of our first responders, our healthcare workers, and for the families that have a loved one that's affected by COVID. We are practicing a different type of medicine once you get to that environment, and you don't always have the same family supports for patients that are there, was my particular take. And you're also moving at a pace that maybe isn't, in emergency medicine, we are very used to going quickly and changing very quickly, but this is a pace where it's kind of constant for your entire shift and then some. So I think that making sure that our first responders and our staff are well supported throughout all of this, as well as the families and loved ones who might not be able to come into the hospital to be with their family and loved ones throughout all of this, is also incredibly important. But from what I've seen about Rochester, it's always been able to come together as a community, and I have no doubt we'll be able to do the same thing.
Thanks. Quick follow-up. I'm going to phrase this carefully. As you know, social media is loaded with experts who might not even have any medical training. And constantly since the beginning of this, we've seen some rhetoric about comparing this to influenza. You as emergency healthcare workers have dealt with influenza, I'm sure, for years, throughout your careers. And we see the numbers and we see all that. What would you say to that argument that's out there that why are we doing this for COVID-19 when we don't do this for influenza?
I think it's a great question. I think that they are two very different disease processes. I think what we found in terms of transmission rates for COVID-19 are they're quite a bit higher than they are for influenza. And I also think that there is a flu vaccine. We don't have any preventative measures at this point for COVID quite yet. And the other piece of it is there seems to be some subsegments of populations that are hit very quickly, very hard by this particular virus, and they aren't as predictable as it might be the case with influenza. In other words, while they're both viruses, they're two entirely different illnesses.
Okay.
Thank you both. Thank you all three very much. Appreciate it.
Thank you, Doug. Next, Jennifer Lukey from WHEC Channel 10, then Will Astor from the Rochester Beacon, and then Noelle Evans from WXXI. Jennifer?
Hi, everyone. Thank you again for your service and for what you did. I'm wondering on a personal level what your friends and your family members said when you told them you were going to the hotbed of this pandemic.
You know, I can speak to that. My wife was not very pleased about it. I can tell you that all these plans came together very fast. You know, we got the email on Tuesday night that we were considering putting together a team and we're looking for volunteers. I emailed back Wednesday morning that this was something I was interested in. And by Wednesday afternoon, the ball was really rolling. So,
Psychiatry 2, 9200. Assistance needed staff. Psychiatry 2, 9200.
Life goes on.
Life goes on.
Life goes on.
Right. So I, you know, things were a little frosty at home for a few hours after this all got put together. But you know, I think I speak for all of us when I say that we're all very well supported by our families, and ultimately, I think everybody felt a duty to go and help and a duty to learn, and all of our families were ultimately very supportive and pleased that we went.
I also think a lot of our families, a lot of our friends, and a lot of our colleagues were probably afraid. It's still an unknown, you know, we don't know the face of the monster here in Rochester. A couple people have mentioned there's a lot on social media. There's a lot out there that you can read about, and we really didn't know what we were walking ourselves into. And sort of the brain of emergency medicine people is, I want to go find out and I want to go figure out how to help. And I think that it would have been more disconcerting for some of us to have that opportunity and not go and see what we potentially are getting ourselves into as a community also. So if anything, and I think once it was framed that way for a lot of the people that were worried about it, there was another layer of perspective that may have been helpful.
Wendy, did you want to?
I would just say that my family wasn't surprised at all. And they're supportive, they always are. I'm very blessed. My family, my kids, my husband, everyone was cheering me on, and so they weren't surprised I wanted to do this. So.
And you all mentioned briefly that you've learned things that you're going to bring back here so that we are ready if and when our surge comes, if you will. Can you outline some specifics? Is it like the layout of where everything is? Is it sectioning off certain areas in the emergency room? Is it how to get PPE on quick and better? What are some of the specifics, if you can?
I would say probably my top two things are the importance of taking care of our staff and our staff resiliency and support. And that kind of goes hand in hand with making sure families are connected with their loved ones and just the impact that has on their care. And so some of the things I'm already working on are just making sure that we have great support in place for our patients and families and our staff. That's probably one of the biggest things, as well as some of their team nursing staffing patterns I thought were really interesting and things that we could use that way.
Yeah, I would reiterate what Wendy has said about you know, supporting staff and kind of coming together as a team to cope with this crisis. I also thought some of the ways they were implementing, you know, conserving PPE and you know, preventing self-contamination and things like that were informative.
They also are doing the same thing that we're doing, which is coming together not as an individual institution, but as an organization. And every single morning there is a rundown of what resources do we have, what's our burn rate, what's the next steps, are there any other things that we could be doing? And none of it was put on the emergency department's shoulders, none of it was put on the ICU shoulders, none of it's put on a specific department's shoulders. It really is, this is the entirety of our resources. How can we all come together and really make this work? Some of it is physical layout. Some of it is, some of you have seen that tent that we put up in front of Strong very quickly that may seem daunting to look at, but I think getting that up very quickly was on the right track. I think it's much easier to put that up now as opposed to when we're in the thick of it. Figuring out how we divide up our emergency department, figuring out how we staff our critical care areas. And the floors in the ICUs here they have essentially reinvented how they're running the floors in ICUs in a matter of 1 or 2 days. And I think what I was most impressed with is those talks and those plans were already put together before we were in the thick of it. And that's exactly what some of these hospitals that we went to are already doing, but they had to do that while they were in the thick of it because they didn't have the lead time.
Thank you. And now Will Astor from Rochester Beacon. Do you have a question?
Yes. Can you compare what you saw at Northwell and what you're seeing when you come back and what you saw when you left? What are the differences?
Do you mean, is there a difference here in Rochester in the week that
Between a difference here in Rochester between what you're experiencing and have experienced here and what you experienced at Northwell at those institutions?
Yeah, I would say there's a lot of similarities as far as we're a few weeks behind them, so we haven't gotten ourselves into that situation where we have the numbers of people here that they do there. But I could definitely draw some similarities as far as the teamwork, the collaboration, the planning. I think Andrea had said it earlier, but just the pre-planning that we're doing now is what they had to do on the spot. So those would be very similar. Right now we're, at a lower census and we're still preparing, so.
I think also here we are still in this stage of unknown because I think there's a lot of models out there and we really don't know how this is going to pan out. And so they know what their situation is. And here we're still in that somewhat limbo state. And so with that limbo state, bluntly comes probably another layer of anxiety that I think that Northwell probably experienced before they got very inundated. And it's very interesting because within a matter of 24 hours of that peak for them, talking to all their leaders and talking to all their docs, their nurses, environmental service workers, that anxiety level almost dropped because you know what you're working with at that point. So I do think that there's probably a layer of anxiety here that is a little bit higher than Northwell, just because it's unknown what we may be in for.
Will, did you have a follow-up question?
Well, not really, but let me ask, what were your accommodations there? Where did you stay and how was that?
We stayed at the Holiday Inn Express in Roslyn. It's a really nice area. The staff at the hotel was they were lovely. They were extremely welcoming and accommodating. Everyone really was. We had the hospital system arranged a transportation service to ferry us back and forth from the hotel to the hospital, and everyone was great.
Yeah, they could not have been nicer. They bent over backwards to make sure we were okay. We tried pretty hard to sort of stick to ourselves off shift, but we ordered lots of takeout to support the local economy.
Lots of takeout.
And Noelle Evans from WXXI. You're unmuted, Noelle.
Hear me?
Yep, there you go.
Okay, sorry. Using a recorder, so the headset was connected to that, not the computer. So thank you all for doing this. My question is sort of a follow-up to what you had mentioned before regarding the sort of supports that healthcare workers need and also families of patients and patients themselves. So could you describe a bit more specifically what that would look like if those supports were in place, and if that's, emotional support, and anything to that nature?
Some of the specific things that we're doing, I think is what you're asking. So some of the things we'll be doing is having EAP, which is an Employee Assistance Program, as well as UR support, both programs that exist already here at Strong, and they're making plans to do extra rounding on the staff. We also, they'll do some Zoom meetings, all kinds of things so that we can maintain social distancing, but yet still be able to hold debriefings and give individual counseling. There's all kinds of things available for the staff. And then we have a very active patient and family relations team, and some of the things they currently do right now for the families who can't come in to see their loved ones because of the visitor restrictions. They make sure that they can sometimes meet them at the door and bring something to the family member. They facilitate phone calls and communications back and forth. And we really try hard to support them. And I know that our hospital is also supplying iPads so that people can physically see and talk to their loved ones, and the patient care team as far as providers and nurses go as well.
Noel, did you have a follow-up question?
At the moment, no, thank you very much.
Okay, I think
someone asked, just for some clarification, were there 14 or 15?
There's
people?
14 of us.
14.
so. 14 people, not all of them stayed the entire week, right? Some came
Correct. There was a little bit of a staggered return. We do have another team that's down there now, and they're staying the entirety of the week.
If I'm not hearing...
Can I jump in? It's so useful here with University Communications. Can I also jump in with a quick clarification question? So you said 14, and then you said there's a team down there now. So what is that part of the total of 14, or is that an extra team?
Nope, it's a second team altogether. It's another compilation of docs, nurses, and APPs. They're down there for a second week. We sort of traded off.
And do you know how many they are?
If you give me a second to do math, yes.
6 nurses.
And 8 providers. And how many?
14?
3. Yes, it's 14 again.
Yeah, 14 again.
14 together. Okay, and I noticed, please correct me if I'm wrong, I noticed that you were all talking about North Shore University Hospital.
We're talking about Northwell Health. Northwell Health, it's a health system. North Shore is one hospital where a couple of our nurses went, and then Long Island Jewish is the other hospital.
Great, okay, that was my question. So you were split up between those two places.
Correct.
Okay, thank you.
Sandra, and I'll, as we wrap up here, I should say where we are. We are in the lobby of the School of Medicine and Dentistry. Although you heard the page for psychiatry, we're far from clinical areas. Still, we honor the universal masking throughout the institution, and that's why we had to ask our panelists to wear masks, and I'm wearing a mask off camera as our technical crew. If media folks would be interested in talking to the second group that comes back next week, please send that and any other question to mediainquiries@urmc.rochester.edu. And if there's significant interest, we'd be happy to do one of these again. We're planning another media briefing on a research topic on Thursday, and you'll hear more about that from our team. And I think with that, we can wrap this up in exactly 30 minutes. And thank you guys very much for the service you gave and for talking to media.
And also, if I can close things out by saying thank you to URMC for supporting us going, and thank you to our community for supporting us going. We really did benefit our community by being able to go.
All right.
Thank you to everybody.
Thanks everybody.